Hi, I recently started my clinical site at Turkey Run. I have a lot of recurring patients. When I first started taking history questions, I was very nervous because it was my first time doing anything like that with patients and interacting with them like that. And so my first patient that was starting his rehabilitation until he was cleared by the doctor for a fractured growth plate. He was on the football team, so he was working on strengthening his ankle. He was my first patient I ever asked any history questions or anything like that, and I missed a lot, so my preceptor had to help me through it. And I didn't really get around to all the important questions like how much pain he was in, if he had any pain. I forgot to ask him if he was taking any medications, if he had any popping or clicking or anything like that. The more days he came in, the better I got because I would ask him more and more questions, so I'd get back around to the ones I missed. Oftentimes you can do that if you don't ask all the right questions the first day. You can often ask them the second time they come in because you'll most likely get recurring patients. And my first patient, he had fractured his growth plate in his ankle during a intramural summer baseball league while during a game, and he was running and he just landed on it wrong. He had gone through all the steps with the doctor, the cast, the crutches, the whole 9 yards with that, and he came back to school this past semester, and he was out of the boot, out of the cast, and all that, and so he was just going through the rehabilitation until he was cleared by his doctor, and so he could play again. And so he was just working on strengthening, and while he's working on those, I'd work with him and ask him questions while doing so. I was very, very nervous. Honestly, I was not the best clinician to be probably working with him because of it, because I did miss so much. But it was a good learning experience, and whenever he came back the next couple of days, I did ask him the questions I missed that my preceptor talked to me about. Um, I began getting more and more patients after that, and I was getting a lot better with my history questions. I was able to ask them all the questions I knew I missed with my first patient, and oftentimes they came back again, so I would come up with even more questions about their daily living, if their pain affected that. Um, I would ask them questions if their pain had affected the way they play their sport, if they're compensating for anything, if it hurts. Like, I had a couple volleyball players that their shoulders on their serving arms were sore, so I would ask them if it also hurt when they went to like put up their ponytail or if they went to spike the ball or anything like that. Um, I would even sometimes ask them about their medication if they were taking any. I'd ask them about the pain scale on a scale of 0 to 10, 0 being no pain, 10 being the worst imaginable pain, how they felt. My questioning for my patient history and my past history have gotten a lot better. I began asking more about if they had any kind of uh, previous injury in the area, if they had anything like that that might be affecting that area. So, I mean, I had been getting better, and I hope to get even better as time goes on in my clinical program with my questions. And I know that, like, most questions, whenever you're asking your patients, you typically start off with one, like, what is your complaint, what is your injury, basically, and then you kind of roll on from there. You ask them how they got their injury, you ask them how much pain they're having, what kind of pain they're having. Typically, each question that you ask is supposed to kind of hop off of each other. So the first question you ask is going to be related to the next question you ask. Next question you ask is going to be related to the next one. They're all supposed to kind of connect, and eventually you should find your answer to maybe what the possible pain is, or maybe you're able to start doing exercise with them to try to figure out which muscle or which ligament or something might be hurt. And so you're able to actually start that kind of testing. And once you get some of your answers that you need to start first. And honestly, I've been getting better at learning how to piggyback off of my previous question to start off the next question. If somebody comes in, say they're complaining about their lower back hurting, you can start asking what kind of sport they do, because what kind of sport they do might affect why they have that lower back pain. Like, I had a patient come in and he played tennis and he also played golf. And he didn't understand that, like, his heavy bag from golf might have an effect on his lower back, and that he doesn't stretch his hamstrings at all for tennis, and that had an effect on his lower back as well. And so it was just a bunch of factors leading into that. But by asking just a couple questions, you get like a whole variety of other questions ahead that might actually help you answer your questions and stuff like that. It's a really great learning experience, and I'm still in the process of learning, and I just hope to get better with my patient histories and asking them questions and getting comfortable with my patients. I know I have a lot to learn, and I know that patient histories are only going to get easier the more I practice with my patients. I only get a couple patients a day at Turkey Run, so hopefully I'll get better maybe by my next rotation. And just remember that when you start off, it's okay to be nervous. You just got to learn that if you miss questions, you can always go back to them, especially if they're a recurring patient, and that your questions should always follow the one before it. And so that's basically what you need to know to ask your patient histories. It's not hard, it's very easy, you just might get nervous about it.